If you've watched this channel from the beginning, you've covered a lot of ground. Enrollment deadlines, permanent penalties, Medicare Advantage traps, Social Security timing, IRMAA surcharges, coverage gaps, irreversible decisions, hidden costs, and the connections between programs that most people never see coming. That is a lot of information, and today, we're bringing all of it together into one place, one list, a complete Medicare checklist of everything you need to do in the right order before you turn 65. Think of this video as your Medicare command center, the place you come back to when you want to make sure you haven't missed anything, the video you share with a family member who is approaching 65 and doesn't know where to start. Bookmark it, save it, send it to someone who needs it, because by the end of this video, you will have a complete roadmap from where you are right now to the moment you walk into retirement, fully covered, fully prepared, and without a single preventable mistake. Let's do this. Welcome back to Medicare Exposed. No commissions, no plans to sell, no agenda, just the truth about Medicare and Social Security, every single week. If you're new here, this is actually the perfect video to start with, and then go back and watch every video on this channel for the deep dive on each item on this list. Hit subscribe right now. Let's get into the checklist. Checklist item number 1. Find your Medicare eligibility date. This sounds simple, but you'd be surprised how many people don't know exactly when their coverage begins. Your Medicare eligibility date is the first day of the month you turn 65. If your birthday is on the first of the month, your eligibility date is actually the first day of the prior month. Write this date down. Put it in your calendar. Set a reminder for 3 months before that date, because that is when your initial enrollment period opens. And missing your initial enrollment period, as we covered in video 1, results in a permanent penalty that follows you for the rest of your life. Checklist item number 2. Check your Social Security earnings record. Go to ssa.gov. Create a My Social Security account if you don't already have one. Review your earnings record for accuracy. Every year of earnings that is missing or incorrect directly reduces your Social Security benefit. And your Social Security benefit, as we covered in video 10, is the check from which your Medicare premiums are automatically deducted. Errors in your earnings record are more common than most people realize, and they can only be corrected with documentation, which becomes harder to find the longer you wait. Do this now, while the records are still accessible. Checklist item number 3. Understand your IRMAA risk. Look at your income from 2 years ago. Compare it to the IRMAA thresholds, available at ssa.gov. If your income 2 years ago was above the threshold, you will pay Medicare surcharges when you enroll. If you had a one-time income event, a property sale, a large retirement account withdrawal, a business sale, and your income has since dropped, file Form SSA 44 to appeal your IRMAA surcharge. If you are still working and approaching retirement, work with a financial planner to time large income events in ways that minimize your future IRMAA exposure. Checklist item number 4. Decide whether to enroll in Part B immediately or defer. This decision depends entirely on your employment situation. If you are retired or your employer has fewer than 20 employees, enroll in Part B during your initial enrollment period. No exceptions. If you are still actively employed and your employer has 20 or more employees and you are covered by that employer's insurance, you may be able to defer Part B without penalty. But get written confirmation from your HR department that your coverage qualifies as primary insurance under Medicare rules. Do not guess. Get it in writing. And remember, COBRA does not count. The moment your active employment ends, your special enrollment period opens, and you have 8 months to enroll in Part B, not a day longer. Checklist item number 5. List every doctor and specialist you currently see. This list is critical for the next step. Every physician, every specialist, every hospital you prefer. Write them all down, because the Medicare path you choose determines whether you can continue seeing these providers. Original Medicare, Parts A and B, is accepted by virtually every doctor and hospital in the United States. Medicare Advantage has networks. And if your doctors are not in the network, you either pay significantly more or find new doctors. This list protects you from one of the most common and painful Medicare mistakes, choosing a plan, and then discovering your doctor doesn't accept it. Checklist item number 6. List every prescription medication you currently take, every drug, every dosage, every frequency. Then go to Medicare.gov Plan Finder, enter your medications, and compare the annual drug costs across every Part D plan available in your zip code. The difference between the best and worst Part D plan for your specific medications can be thousands of dollars per year, and this comparison takes less than 20 minutes. There is no excuse for skipping it. Checklist item number 7. Make the original Medicare versus Medicare Advantage decision. Using everything you've gathered in steps 5 and 6, your doctor list, your medication list, your health situation, your financial situation, your risk tolerance, make an honest assessment of which path fits your life. As we covered in video 11, there is no universally right answer, but there is a right answer for you, and now you have the information to find it. If you are still unsure, book a free appointment with your SHIP counselor before you decide. shiphelp.org. Free, unbiased, no commission. This is what they exist for. Checklist item number 8. If you choose Original Medicare, enroll in Medigap during your guaranteed issue window. This window opens when you first enroll in Part B at 65, and in most states, it closes 6 months later. During this window, no Medigap insurer can deny you coverage or charge you more based on your health. After this window closes, they can, and will, enroll in Medigap while the window is open. Do not wait to see how your health develops. Do not assume you can always get it later. You cannot. Not at guaranteed issue rates. Not in most states. Not once the window closes. Checklist item number 9. Enroll in Part D drug coverage, even if you currently take no medications. As we covered in video 9, skipping Part D because you're currently healthy is one of the most expensive Medicare mistakes you can make. The late enrollment penalty, 1% per month for every month you go without creditable drug coverage, is permanent. And the medications most people need in their 70s and 80s are among the most expensive on the market. Enroll in the lowest cost Part D plan available in your area, even if you never use it, to protect yourself from the permanent penalty and from the drug costs you will almost certainly face in the future. Checklist. Item number 10. Decide when to claim Social Security. This is the last item on the checklist, but it is not the least important. It may be the most important financial decision of your entire retirement. As we covered in video 4, the difference between claiming at 62 versus waiting until 70 can be over $300,000 in lifetime income. Run your personal break-even calculation. Go to SSA, Gov Retirement Estimator. Get your exact benefit amounts at 62, at your full retirement age, and at 70. Calculate your break-even age. Consider your health, your life expectancy, your other income sources, your spouse's benefit. And make this decision with data, not fear, not rumors, not because a friend told you to claim early, with actual math. Checklist item number 11. Plan for the gaps. As we covered in video 6, Medicare does not cover dental, vision, hearing, long-term care, overseas travel. These gaps are real, they are expensive, and they are completely predictable. Budget for standalone dental and vision coverage. Have an honest conversation about long-term care insurance before you need it, while you can still qualify for it at reasonable rates. Purchase travel health insurance anytime you leave the country. These are not optional extras. They are essential parts of a complete retirement healthcare plan. Checklist. Item number 12. Calculate your real monthly retirement income. Not your gross Social Security benefit. Your real number. Social Security benefit. Minus Part B premium. Minus Part D premium. Minus any IRMAA surcharges. Minus your Medigap or Medicare Advantage. Premium. Equals your real monthly healthcare adjusted retirement income. Know this number. Budget around this number. Because this is what retirement actually costs. And the people who know their real number before they retire are the people who can actually afford to live the retirement they planned. 12 items. 12 steps between where you are right now and a retirement where Medicare works for you instead of against you. Let me read them back to you one final time. 1. Find your Medicare eligibility date. 2. Check your Social Security earnings record. 3. Understand your IRMAA risk. 4. Decide whether to enroll in Part B immediately or defer. 5. List every doctor and specialist you currently see. 6. List every medication and compare Part D plans. 7. Make the original Medicare versus Medicare Advantage decision. 8. If you choose original Medicare, enroll in Medigap now. 9. Enroll in Part D, even if you take no medications. 10. Decide when to claim Social Security, with math not fear. 11. Plan and budget for the coverage gaps. 12. Calculate your real monthly retirement income. 12 steps, that is the complete roadmap. And every single one of those steps has a full dedicated video on this channel, walking you through the details, the traps, and exactly what to do. If this video helped you, please share it with someone approaching 65 who needs it. This is the video that could change the course of their retirement. Hit subscribe and turn on notifications, because we are just getting started. Every week, another Medicare or Social Security truth that the industry hopes you never find. We'll see you there.